Hi everyone, this is Pavitra, working as an assistant professor in Sri Muthukumaran Institute of Technology in Biomedical Department. Now we are going to see about lecture on assistive technology, Unit 1, Part 3 video this is. These are the core objectives of this subject. We can know about the hardware requirements of assistive devices and to know about the prosthetic and orthotic devices and to understand about the recent trends and technologies in the assistive devices. At end of this course we can able to know about the various mechanical techniques and we can able to know about the hemodialyzer machine and we can able to know about the hearing aids and also about the mobilization of the assistive device and also about the nerve simulator and feedback systems. These are the 5 units in this subject. We will see cardiac assist devices unit 1 now. We have already seen about external counter pulsation technique in part 1 video and intra-aortic balloon pump in part 2. Now we will see in this part about auxiliary ventricle for left ventricle like a bypass. Ventricular assist device VAD. It is a electromechanical device that supports the hearts to function when the left ventricle of the heart works to fail. VAD is differs from pacemaker. VAD gives mechanical support to the heart while pacemaker gives electrical impulses to the heart. VADs are short-term use to recover the patients from the myocardial infarction like a heart attack and recovering from cardiac surgery. Some some more use this for long term. Typically, they are suffering from advanced heart failure. There are two types of VADs are available: RVAD and LVAD. RVAD is used for right ventricle and LVAD used for left ventricle. There is also another type BiVAD to assist both ventricles. VAD implanted depends on the type of the heart disease. When the heart fails to work right ventricle, then RVAD will be used. If it fails to work left ventricle, LVAD is used. Most commonly used method is LVAD. Left ventricular assist device is the most common method. The right side of the heart is often able to use the heavy blood flow, but the pulmonary atrial resistance is high. So, RVAD might be easier to resolve the problem. If both LVAD and RVAD is needed, BiVAD is normally used. Why LVAD is done? Why we are using LVAD? When the patient is awaiting for the heart transplant for a short, they can use LVAD. This is a treatment like bridge between transplant of heart. LVAD can pump blood through your body despite a damaged heart. It is removed when the new heart is transplanted. Who can't have heart transplant, they can use this LVAD for long term. Some patients will not able to accept their body condition will not accept the heart transplant due to the age criteria, then in that situation LVAD is used for their rest of life. When the heart failure is temporary, then we can go for LVAD. How we can decide LVAD treatment is right for the patient condition based on these criteria. When the heart failure is severe and the main pumping chambers of heart are working, and how how much social support they get from the family and the friends, and their mental ability to take care of a ventricular assist device. Based on this we can go for this treatment. During this procedure we can face these problems: bleeding. Any surgery can increase the risk of bleeding, and this is because surgery in this will be done in the heart, so we can saw the problem as blood clots and the infection. Every surgery, every invasive surgery will have some infection problems. Device problems. Sometimes LVAD may not work after the implantation because of the damaged wire or any other reason, and at that time we can seek for immediate medical attention. When the right heart failure, if we give LVAD, then the risk will be higher. How we have to prepare for the LVAD surgery? Surgery will be done in the chest area. So before the surgery and during the surgery and after the surgery, the expert will say what we have to do and what are the risks we have and what are the procedures we will follow after the surgery and what are the medication we have to follow after the surgery. All will be given by the surgeon. After the procedure, we have to stay in the hospital for observation. During the observation, the surgeon will absorb whether our heart functioning properly and our urinary tubes are working properly, our bladder is cleaning in cycle, everything the surgeon will observe. During the LVAD procedure, it requires open heart surgery. So for that surgery, the chest area air will be removed before the surgery, and the IV line will be um, inserted in the patient, and your heart may be stopped using medicines during the surgery. Temporarily, heart lung bypass machine will be used for your heart functioning. During the procedure, surgeon will cut down the center of the chest area. The surgeon separates the chest bone from the chest bone to view the better heart properly, and then the device will be placed. After the surgery, what are the foods and medicines should be followed is given here. Some list of some medicines will be given by the hospital, and also about the food list, and usually need to stop eating or drinking for several hours before surgery. For any surgery we have to stop eating or drinking before the surgery. This is the parts of the LVAD. LVAD main pump is placed in the tip of the heart here, and the blood flows through the plastic tube of the LVAD and goes to the body of main artery called aorta. From aorta, blood sends to the rest of the body. This is the battery, rechargeable battery for the LVAD, and this is the system controller which controls the LVAD working. A card is inserted through the opening in the skin, connects the pump to a control unit and battery backup outside the body. After LVD is working properly, we can take the heart lung machine from the patient. Thank you. For more videos, subscribe SMIT YouTube channel.